Halo, saya Dr. Sophia. Saat ini saya ada di Barcelona, Spanyol. Saya bersama dengan Dr. Victor dan saya akan mewawancara beliau dan insya Allah apa yang disampaikan bisa bermanfaat untuk kita semua. Hi, Dr. Victor and Dr. Sophia from Indonesia. I want to ask you 3 questions. The first question, how about your opinion about LASIK surgery? Some opinions said that LASIK surgery is cosmetic surgery, but the others said that therapeutic. And what's yours?
So for me, cosmetic surgery, it's rather plastic surgery, which we are also grateful that we have such a type of surgeries. But in terms of laser vision correction, I wouldn't classify it as a cosmetic surgery. Having a visual default, having diopters, having myopia, hyperopia, astigmatism, it's rather a handicap in daily life. So in order to correct this visual default, we can wear glasses. But for example, if someone is a -7 or -10, so the world is very small and we don't have the visual field. So in correcting this kind of people, they gain life quality, and this is not cosmetic. Same thing for presbyopic people. Treating presbyopia avoids people of, for example, having the problem that they lose reading glasses and they don't function. So for me, in laser eye surgery, there is only one type which we can classify as cosmetic. This is keratopigmentation. If a patient comes to me and wants to have, for example, from dark eyes, very whitish eyes or blue eyes, this is cosmetic and this is dangerous. So this might destroy the cornea. But of course, if we have some iris problems, then this is therapeutic surgery. But in terms of correcting visual defaults, this is definitely not cosmetic, but this avoids you or improves your life quality. Imagine you need to wear contact lenses, and we have a high chance of getting keratitis or infection of the cornea while wearing contact lenses. So having refractive surgery, this prevents of having this kind of complications. So as for me, and I think in the community is widely spread, refractive surgery, laser vision correction, or implant surgery is definitely not classified as cosmetic surgery.
The second question, from all type laser vision correction, for your opinion and for your experience on your patient, which one the most wanted by your patient?
So we have today 3 generations of laser eye surgery. The oldest one, surface treatment like PRK, trans-PRK, then we have a femtolasic, and then we have a lenticular extraction, for example, smart side, smile, clear, or SILC. And I think all of this technology is great. They're all great, but each of them has its advantages and disadvantages. And so we can use for various visual defaults, various techniques. So we can have a patient who has, for example, some superficial scars, is myopic. So in that case, I would choose even the simplest technique, like a surface treatment. If we have a hyperopic correction, so as for me, we have only one choice. Or maybe today now with the introduction of hyperopic smile, maybe the second one, but it's very new. But the standard for hyperopic treatments is basically femtolasic. Then the third generation, lenticular extraction. So if we have a patient for -3 myopia, so we can perform either surface treatment. Disadvantage is longer visual rehabilitation. Then we have a femtolasic, which is great. Advantage, super fast visual rehabilitation, but we have here a flap. So a flap might be a handicap, for example, for people who perform contact sports. So in that case, if someone wants a fast visual rehabilitation or very fast visual rehabilitation without having a flap, I would suggest lenticular extraction, which is probably here the best. Another big advantage of lenticular extraction is we have no flap, we have less dryness, and what we also know from the data, these patients have less so-called spherical aberrations, so visual symptoms at night. And this is a big advantage over the other techniques. But again, I wouldn't say that there is a one preferred technique for all of the patients, but we need to customize it, customize the treatment for a specific patient in order to get the best results. And of course, at the end, there is a financial aspect. We have a cheaper treatments and we have a more expensive treatments, but at the end, we can offer a patient, a treatment which he can afford and which is the best for this specific visual default.
Can you tell us about how many your experience in LASIK surgery? And also, maybe can you give us advice, something for medical student or ophthalmologist who wants to one-to-one LASIK surgery?
Learn or perform?
Learn and perform.
Perform. Okay. So my experience in LASIK surgery is around, I believe, around 18,000 cases in refractive surgery. So for laser, most of the cases I perform temporal LASIK. Since 4 years, I'm performing also some outside. So I think I performed so far around 2,000 cases. For medical students, I think the first most important step is to learn how the technology works, what are the limits, what are the possible complications, and how to solve them. And very important is to find a personal mentor and to observe his surgery not once, but on a regular basis, once a week, twice a week, to see how this works. And this is on the surgery. But on the other hand, that once each refractive laser surgery is very simple, but it has a very small steps and with a lot of precision. And prior to the surgery, we have the qualification and the exam. So I think learning how to perform the exam, how to talk to people, how to learn the needs, the expectations is crucial, because sometimes it's better to tell the patient, no, you're not a good candidate for the surgery, in order to treat everyone. So I think the ability to qualify well a patient, the ability to counsel is the biggest gift and leads to perfect results. We know that the technology is perfect. We just need to learn how to use it and how to choose the best patients in order to get perfect results. Because at the end, only the results and the quality of the results counts.
Thank you, Dr. Victor. And we have to close this interview. And para sahabat SILC Center, terima kasih banyak sudah mendengarkan. Saya bersama dengan Dr. Victor di Barcelona, Spanyol. Insyaallah apa yang disampaikan bermanfaat bagi kita semua.
Inat Lasik, Inat SILC.